Hello, this is Gina Piscatelli with the fifth lecture on the skeletal system. And in this lecture, I will focus on bone fractures and the process of bone repair. So there's a lot of different ways that we can describe a bone fracture. We'll say types of bone fractures. One way has to do with the health of the bone. Okay, it's two types of fractures based on the health of the bone. So a stress fracture is normal, healthy bone exposed to an abnormal trauma. Versus a pathological fracture, now you have abnormal bone, sometimes weakened by disease. There's a number of reasons, but then a normal trauma to this weakened bone, like a bump on, you accidentally bump your arm on something, can result in a bone break or fracture. So this is one way to classify bone fractures. Is it a stress fracture or is it a pathological fracture? There's many other ways, as I mentioned, to classify bone fractures. One is, where is it located? Which bone? Where within the bone? And another has to do with what you would see on X-ray, the configuration of the broken bone or its pieces and how many pieces there are. So first we'll talk about location and then configuration. So a fracture classified based on its location would be you name the bone and maybe where within the bone. So for example, on the left I have a picture of a middle phalanx. I think it's the middle phalanx number 1. It's the epiphyseal fracture. So what this means is the epiphyseal line was still weak in a growing child. It'll probably heal, but if not, if it doesn't heal or it ossifies, that could cause premature arrest of growth. So it might not get any longer. But anyway, the way you would categorize it is you'd say where and what bone. Middle phalanx 1, epiphysis. On the right, we have the fracture of a humerus, and one way to describe the location would be in the diaphysis, right in the middle, so mid-diaphysis. Now let's talk about how we classify fractures based on what you would see in X-ray based and looking at the position of the broken bone. So we use the terms displaced or non-displaced to describe the fracture. The same picture that we looked at before of the finger break, right, is that it's non-displaced. The pieces of the fractured bone are still in alignment. That's good for repair. But the picture on the right is a displaced fracture. So the definition for categorizing something as a displaced fracture is that at least one piece of a bone has to be out of alignment. Here we've just got two pieces anyway, but it's clearly displaced, not lined up at all. Here's another set of examples for displaced versus non-displaced. So the picture on the left shows that both the fibula and the tibia are broken. Both are displaced fractures. And then on the right, we've got the end of the humerus. That's a non-displaced fracture. You can just barely see the fracture there. Which brings up the concept of, is the fracture complete or incomplete? That's another way to categorize fractures. If the bone is completely broken, we say complete. And there's some pictures on the left, one of the ulna and one of the femur. Those are both complete fractures. Now on the, I guess it's the radius. Sorry, it's the radius, not the ulna. But anyway, on the right, there are two fractures. Okay, three. One picture up on the right is the femur, and you can see that the femur is not completely broken, so that's an incomplete fracture. And down in the arm, we see both the ulna and the radius are fractured but incompletely. Now there are different subcategories of complete fractures. One is a comminuted fracture, and another is a segmental fracture. So in the segmental fracture, I'll take this one first. The bone is broken at two places, so two complete fractures in one bone, and there's a floating piece in the middle, right? So we can see that right here. So that's an example of a segmented fracture. It's complete at two locations, but segmented. Over here, this is really quite sad, actually. This is a mess, right? So this looks like the bones were crushed, and they may or may not have been. I don't know how this happened, but we have complete fractures of two bones, and more than just two pieces. We've got at least three pieces. So there's a piece, here's a piece, here's a piece, and that's three on this one, and then there's three on this one as well. So if a bone experiences a fracture that has these small little pieces like this, and there's more than two, then we call it comminuted. Now there's different types of incomplete fractures as well. One is called a hairline fracture that usually heals pretty well on its own. You can just barely see it right there. Okay, bone is not completely broken, hairline. But then there are others where we call it a green stick fracture because, you know, the branches on a tree that are really young, they're green branches. If you try to break them, they just bend. That's true in children's bones, right? Before they become ossified, because there's still cartilage that's soft in the bone. So what you'll see is that you'll have a bone like this that's just broken in part of it because the bone. So a green stick fracture is a type of incomplete fracture as well. Okay, another way to describe fractures has to do with whether or not a piece of the broken bone has broken the skin or not. If it has, and isn't this gruesome? Okay, right here, we say it's an open fracture. Sometimes they use the word compound fracture to mean that, which is tough because you don't want to get that confused with comminuted. And I don't know if you can tell in this x-ray, but the skin is right there. So this one also broke the skin. So anyway, those are open fractures. Here is an example of closed fracture. So the bone's completely broken. This one's even segmental, but the skin wasn't broken, so we call it closed. Now the process of healing fractures is, I guess, pretty tightly regulated. It happens the same all the time. The first thing that always occurs is that there's a blood clot, and that clot is referred to as a hematoma, sometimes because it's kind of bulged out into the skin. It's not, the clot doesn't stay in the blood vessel. The clot has bulged out into soft tissue of the body. And it's all because a blood vessel was broken in the bone. And then the second thing that happens is that a soft callus is formed made up of collagen and fibrocartilage. And then the third thing that happens is that that soft callus becomes hard with spongy bone. So osteoblasts start laying down bone matrix, and there's some calcification. So spongy bone happens. Now, while this is forming, while the hard callus is forming, it's very important that the bone remain immobile so that it's going to be the right shape and in the right alignment. The soft callus still has some wiggle room. you can readjust it before the bone deposition actually happens in step 3. And then the fourth thing that happens is remodeling. So the callus is actually going to be replaced with, at least some of it, with compact bone. So there'll be osteoclasts and osteoblasts remodeling that hard callus to make it look more like it originally did. So here are the steps. First we have the hematoma. So this is the broken bone with broken blood vessels, not just within the bone, but probably right under the periosteum as well. And that breakage of a blood vessel starts the formation of a clot. Okay, so we have what's formed as a hematoma, and it also results in some tissue kind of being laid down here. Granulation tissue is what we call it. Then in step 2, chondrocytes start laying down fibrocartilage. They were underneath the periosteum. And the granulation tissue now is going to become fibrocartilage with some collagen fibers. Now collagen fibers are pretty strong. So the chondrocytes and the collagen fibers, it's still soft and a little bit malleable, but strong enough to hold the two pieces together. And then in the third step, osteoblasts, again, which are underneath the periosteum, begin changing that soft callus into a hard callus, and it goes all the way across the medullary cavity, and that's where spongy bone is laid, and then also the compact bone kind of thickens at the edges. In the end, what happens though is that osteoclasts will come and carve out that spongy bone that needs to be carved out and make sure that compact bone and spongy bone is adequate enough to knit those two pieces together. So that's the bone remodeling process. We're going to work on this worksheet during our live lecture, so I'm not going to go over it here. And we'll do this one and this one. So that's all for bone fractures. We'll talk about them again in our live lecture this week. Thank you.